Now to a story about a Zachary woman who has a second chance at life in the face of heart disease. 48-year-old Afshan Mobeen suffered a massive heart attack while in the emergency room. She actually died right in front of doctors. But they were able to bring her back to life. And now she's sharing her incredible story to help save lives.
Thank you very much. Thank God.
It's an emotional reunion for Afshan Mobeen as she meets the doctor who saved her life, Lane ER doctor Michael Romagera.
She died right there in front of me, and all I could think of was, God, don't let this young lady die.
Mobeen has a family history of heart disease, and her life-changing story all started one night when she started having symptoms.
Her blood pressure was dropping really quick. She was having sweats, and she was having pain, and it came to a point finally where I realized that that's it. She was hesitating to come to emergency, but I made up my mind. I said, no, I have to call.
So she was rushed to the emergency room. Dr. Romagera picks up the story.
Looking at the monitor here, she had a heart rate of about 33, and I told the nurses, get me some epinephrine ready. And they were drawing the epinephrine. I'm gonna turn around. I was looking at the monitor and looking at her, and I'm looking at the monitor, and she went asystole, which means no heartbeat. Okay, no heartbeat, no breathing, no heartbeat. I immediately started CPR with one hand. I said, give me the epi, and then she came right back. We started CPR on her. She gave the epi, about 30 seconds of CPR, and all of a sudden we got us her heart rate back. I said, give me a pressure. Her pressure was fine. Okay. I then came around the table. We intubated her, put a tube in her lungs so we can give good respirations. Dr. Deepak walked into that door, and we had a conversation at that time about what's going on, and we were thinking that maybe this was, maybe this could be a bad pneumonia or whatever there. And I said, well, I'm really thinking this is cardiogenic shock.
After they got her back, she was rushed to the cath lab, where Dr. Deepak Takut opened up the blocked artery that was causing the heart attack.
She had a very favorable result, and it's wonderful, great feeling.
Now they're sharing the story of the miracle of Mrs. Mobeen to help others reduce their risk and save lives.
If anything, when you have heart pain or anything, or you feel your blood pressure is going up and down, I learned from experience, just come to emergency. Don't worry about anything else, just come here, and before it gets worse, resolve it.
Time is muscle. The longer someone is having chest pain, the longer the blockage is in place, the more damage you have to the muscle. And we try to get these arteries open as quickly as we can. It's important to get them open up within 90 minutes of the onset of pain, or with the onset of the time the patient comes to the emergency room, gets to the cath lab, and the artery is ballooned open, and we have improved flow. We try to get that under 90 minutes. Oftentimes we can do it under 60 minutes and sometimes under 30 minutes.
I pray. God relation very good, strong, no problem.
What an incredible story.